Thank you for the invitation to speak here today. It's great to be here. So I think Ray did an excellent presentation, Dr. Copes, Ray did an excellent presentation. So there's a few important things that I took from that. One is the importance of responding to all concerns in a timely fashion and giving people information. I think that's extremely important. What comes out of that, though, is not everybody, you need a whole team approach. Not everybody can do it. You need a whole series of organizations potentially to come together to provide a holistic approach. I think it's very important, again, for what OCAL is doing today to bring together a number of partners, and a lot of us work on a frequent basis with the Ministry of Labor, with OCAL, the other HSAs, Public Health Ontario, OCRC, and that's how you come up to solutions to problems. So the Ministry of Labor has a specific role in what it does in workplaces and what it does in prevention, and we've heard a lot earlier today about some of what the prevention component does and what we're doing on the regulatory side with the OELs. So that's all part of the big picture that's involved in responding to or preventing occupational disease. So the Ministry of Labor has a number of roles, and I'll talk and expand a little bit on that they do. So one of it's regularly inspecting workplaces for hazardous chemical agents or physical agents and biologic agents to respond to that. So that's the ministry's frontline operations approach, is enforcement of the Occupational Health and Safety Act, and we have a whole series of resources involved in enforcement of the Occupational Health and Safety Act and the regulations that are accompanied by that. So we heard about the noise regulations also. We heard about the OELs and other regulations that are involved in occupational disease prevention. The regular updates to the OELs are all a component of that. And then the other partnerships that the Ministry of Labor has on a prevention side, either with OCAL, with OCRC, the other health and safety associations, and the other work that we do all fit into that larger picture. The ministry also does a series of blitzes and initiatives also. Some of them relate to occupational disease prevention. I'll talk a little bit about that. And before the ministry undertakes these blitzes and initiatives from an enforcement basis, there'll usually be some information posted on our website or our webinars to let stakeholders know what we're looking for and where in the general sector and what they're focusing on. So we talked a little bit about, Dr. Copes talked a little bit about the response and gave the example of clusters of occupational cancers. Of course, there's more than occupational cancers. You can have clusters of complaints related to non-cancer occupational diseases, whether lead poisoning, we heard a little bit about lead poisoning earlier today, other neurologic disorders, all sorts of issues. And so the Ministry of Labor will respond to complaints that we get from the workplace, single complaints, clusters of complaints, and have a look at those complaints in the workplace. And that may also require partnering with other organizations also. We have a regulation, we have the designated substance regulation that is undergoing some revision in terms of some of the exposures and the requirements. But if there are, for example, a cluster of people with symptoms from lead in the workplace, or we get complaints from a workplace, from workers about symptoms that are compatible with lead, so the Ministry of Labor would respond to that type of cluster also, and then go into the workplace, investigate the exposures, and respond to that. So what are the meeting with the workplace parties, the workers, what are the workers experiencing going into the workplace, what are the exposures, and responding to those. So the ministry has a reactive component in terms of responding to complaints. There's an important component that Ray mentioned that the ministry doesn't do, but other components of the system do, is sitting down and talking to people is not something that the Ministry of Labor does on a frontline basis from our inspection standpoint, right? So when you're looking at, for example, complaints about, say, cancer clusters, as Ray described, as Dr. Copes described. So the role there from a response standpoint from the Ministry of Labor will be going to the workplace and saying, is the workplace safe today? Is the employer complying with the Occupational Health and Safety Act and its regulations today, right? So that doesn't deal with what went on 20 years ago or 40 years ago, or what the potential cause of this cluster is, or explaining it to people. So that's definitely not a role that the Ministry of Labor takes, and that other parties have to look upon to fulfill. So there's certain parameters and limits to what the Ministry of Labor does in terms of response. So that's very important also to understand, and then to look at who else in the system is available to provide that support and that information. So knowing what everybody in the system does is extremely important. It's a bit of a challenge getting everybody to work together on some of these issues. But some of my colleagues here know that we get together frequently and discuss some of these issues and how to best address them in workplaces or in Ontario in general to make it safer. So the ministry, from an operational standpoint in terms of enforcement, has two types of responses in terms of dealing with workplaces. The first is a proactive component, going into workplaces where there aren't complaints and clusters, and looking at enforcement of, and looking for compliance with the Occupational Health and Safety Act and its regulations, right? So what are the goals there? What do we focus on in terms of occupational disease? So this past summer, we had a blitz in the mining sector looking at prevention of occupational disease from various standpoints in the mining sector. So the inspectors went in together with our occupational hygienists, in addition to looking at noise that Mark talked about. In underground mines, the occupational disease initiative that went on focused on ventilation systems, diesel exhaust, and we know diesel exposure is a major issue, surface mine exposures to silica, mill and smelter assessments for designated substances, and the employer sampling program in the mines, which is a little bit different, and what they do there. So that's a very important blitz that the ministry conducted. So that's a prevention blitz, proactive, and going and ensuring that there's a prevention program for occupational disease in place also. There's a few other activities going on this year, for example, also in other sectors in the construction program. When you look at the sector enforcement plan, which outlines what the ministry is looking for, again, on a proactive basis in workplaces in various sectors, posted on the ministry website. Construction, for example, so inspectors are focusing on asbestos exposures, noise, compliance with WMIS. Again, it's similar in other sectors, in the industrial sector, healthcare, looking at some specific exposures for prevention activities. What the focus is what they focus on is, in many cases, set by the prevention system. And so that's when I'm talking about the broader prevention system, when a range of partners will sit down, many people are here in the room, and put in best thinking about what should we focus on for prevention of occupational disease. Certainly asbestos, diesel exhaust, silica, noise are major issues, and that's been reflected in the activities that the Ministry of Labor undertakes on a proactive basis in terms of where do we focus our resources and what type of workplaces to prevent occupational disease and towards that. Raising awareness with information on our website, or again, partnering with other folks and trying to organize that. Again, it's a positive challenge to organize a system for consistent messaging, but I think it's working much more effectively than, at least when I started with the ministry in 1985, when it didn't exist. But today, actually mostly it was me and John Odike, I think, back in 1985, right? So it was like a small group. But now it's a much more coordinated system, and trying to get the message together and get it out and organize that, and I think that's very important. So again, I described the range of prevention measures that you heard earlier today, and our frontline proactive and reactive enforcement activities. As Dr. Copes pointed out, responding to complaints, that's our reactive work, is extremely important. Looking at the exposures in the workplace, determining if there's a hazard today. Probably a weak area is trying to connect people, and we're getting better at that, to other resources. We have a lot of resources on in our sector plan trying to connect people to other partners that'll help them. And our inspectors, many times in the reports, will make note of the other resources that are available, say with OCOW, the Health and Safety Associations, to connect people to those questions and answers that the Ministry of Labor can't answer. So if the Ministry of Labor is going in on a complaint about a cluster, then it has a limited enforcement role. We try and connect people to the appropriate resources, right? So I'll just finish with one example in the past of a cluster that required a major effort. This is sort of earlier on in my career in a company that made cans for the food industry, and they're cleaning the cans before they got shipped out for food packing with N-hexane. So we were getting complaints from workers about neurologic disorders, muscle weakness, I mean, all sorts of weakness. And it took a little while to go in and to look at the workplace, figure out what's going on, what they're using, because this is back in the late 80s, the MSDSs weren't that good in terms of, it said hexane, and you found out later it was N-hexane when we sampled it and looked at it. But it requires a bit of investigative response in terms of looking at it and then responding to it and getting people help that they need. We try and connect people to resources. We've got a couple of medical consultants working for us, besides myself, Dr. Rajaram and Dr. Hudan, that'll also go into workplaces and provide people with some advice and try and connect them to health resources that can help them when you get things like clusters of neurologic disorders from solvents or N-hexane, and try and get people in the right direction also. I think it just gives an overview of what the Ministry of Labor does and how we try and integrate with other organizations on a range of issues. Thank you.